Let's talk for a minute about prescribing for controlled substances. Are there some policy changes on the horizon that you're aware of, and how are you preparing for those?
Very good question, because as of May the 11th, the pandemic is closing as
Mhm.
well. They're saying it's closing. They will no longer recognize it as that anymore, the health emergency. So they have 180 days from that point on that, all our telehealth laws as they are with the waivers and everything are still in effect till then. After that, a lot of places now are putting it in policies though, because it was to keep it going, because it was so beneficial to people and we were able to reach so many more people with services. So for instance, the DEA now had proposed it, as far as I know it's going to be going through, is that they basically said now that you can do any controlled substance except for Schedule 2s, which are things mainly like stimulants, that are able to be prescribed via telehealth. No other changes, anything else has to go along with that. Schedule 2s, they're saying that you have to have either an initial in person or a referral from another physician, which makes it very accomplishable for us to do it, because the majority of what we're going to get when they do it is they're going to be referring from another provider, which meets our criteria. So they were dropping the, seeing them every 6 months and having to do the first in person, which makes telehealth a much easier thing to do with controlled substances. So it makes it feasible, where, what they had before was more restrictive than what we have that's coming up. So if they get that through, like it looks like they're going to, telehealth with controlled substances is definitely something that we'll be able to continue to do.